Hello, welcome to my channel, and today we will learn about the flat bone sternum. This one is the sternum, which looks like a sword. Sternum has three parts: the manubrium, the body of the sternum, and the xiphoid process. The body of the sternum is like the blade of the sword. The manubrium is like the handle of the sword, and the xiphoid process, the sternum is the flat bone, and the length of the sternum is approximately 17 centimeter. Let us see the manubrium. Here is the notch called the suprasternal notch or the jugular notch. On both the side, these are the clavicular notches. Here on the both the side, the notch for the articulation of the first costal cartilage, that is the first rib. Now these are the 7 notches: first rib, second, third, fourth, fifth, sixth, and this one is the 7th rib. This is the sternal angle, which is present at the junction of the manubrium and the body of the sternum. Sternal angle. At the level of the sternal angle, here is the beginning and the end of the arch of aorta. Also the articulation for the second costal cartilage, so that the counting of the ribs is easier, and the trachea bifurcates at the level of the sternal angle. Now let us see the muscle attachment on the anterior surface of the sternum. Here on the manubrium, on both the sides, the origin of the sternal head of sternocleidomastoid muscle, and here is the fan shaped muscles, that is pectoralis major muscle. The origin on both the sides like this. Now here on the xiphoid process, the aponeurosis, the insertion of the aponeurosis of the external and internal oblique muscles of the abdominis, and also the insertion of the rectus abdominis muscle. Now let us see the posterior surface of the sternum. This is the posterior surface. On posterior surface, on the manubrium, there is the two muscles, the origin of the two muscles, sternohyoid and sternothyroid, on both the sides. And on the body and the xiphoid process, the origin of the sternocostalis muscle, sternohyoid, sternothyroid, and sternocostalis. Then here is the attachment on the lowest part of the sternum. Here is the attachment for the linea alba, and also here is the arch of aorta at this level and its branches, that is left subclavian, common carotid, and the brachiocephalic artery. Also we can say that on the posterior surface and on the left side, the upper half surface of the body of the sternum, and on right side, the whole of the body of the sternum is the area related to pleura, and the lowest on the left side, the lower part of the body of the sternum is the area related to pericardium.